Well, good afternoon. We're going to get started with the webinar today. So welcome and thank you for joining Searching for Meaning, incorporating patient and family digital stories into your practice. Thanks for taking the time to be here out of your busy schedule and for choosing to spend the time with us when you could be outside in this lovely weather that we're experiencing here. Just to let people know, we are planning to be recording the main presentation today, so you should have notification that the presentation will be recorded. However, that doesn't include the small breakout sessions that we're going to be doing, so it's just going to be the large part of the section. By way of introduction, my name is Chris Mayhew. I'm a senior consultant with engagement and patient experience. I'm also the lead for our digital story project in our department and act as a steward for the online digital story playlist and platform. And with me today, I'd like to introduce Dr. Mike Lang. Mike is a health researcher, filmmaker, and digital story facilitator. His professional and research focus is on using digital story and documentary filmmaking in education, advocacy, research, and a therapeutic capacity within healthcare and wellness contexts. And I'm also pleased to introduce Erin Coffin. Erin is a special education teacher in Grand Prairie. She's a patient advocate and has been volunteering as an advisor with AHS for the last 4 years. She will be sharing her story today from a parent's perspective of receiving a diagnosis and the journey of working with AHS to build capacity. So before we begin, I would like to recognize that our work takes place on the historical and temporary Indigenous lands, including the territories of Treaty 6, 7, and 8, and the homeland of the Métis. We also acknowledge the many Indigenous communities that have been forged in urban centers across Alberta. We respect the treaties that were made on these territories. We acknowledge the harms and mistakes of the past, and we dedicate ourselves to moving forward in partnership with Indigenous communities in a spirit of reconciliation and collaboration. We are grateful for the Indigenous storytellers who have shared their personal experiences through a digital story in this spirit. One of the goals for today's webinar is to introduce you, of course, to the topic of digital storytelling screening, and it's through demonstration and modeling of this process that we hope to introduce you. We're going to encourage you to actively participate in the process and to honor the contribution of our storytellers in sharing their stories. We also recognize that these stories can be difficult and some topics may trigger a strong emotional response in viewers based on their personal experience. If you are in need of support, you are invited to contact the AHS EFAP program by phone at 1-877-273-3134 or online at www.homeweb.ca. I'm now going to pass it over to Mike. Take it away.
Awesome. Great. Thanks, Chris. Yeah, well, I'm super excited to be here with you all today. Today's actually a really big day. Chris and I were talking about it, 5 or maybe even 6 years in the making, getting to this point. And we're really excited to share with you guys about the Patient Stories platform. But before we do, I think it's always good to start with why. And those of you who know me will have seen this quote before. If you've seen any presentation I've given over the past 12 years, you'll recognize it. And it's really just because I still haven't found a better one about why I think it's important to talk about stories in healthcare. And here it is, Dr. Rachel Naomi Remen. Facts bring us to knowledge, but stories lead to wisdom. And, in healthcare, I think we all understand we're really good at facts and knowledge. We've done a lot of work over the years to give people the information they need, the pamphlets, the brochures, the numbers, the statistics. And one of the challenges I think that's starting to change, is starting to shift, is incorporating more stories of patient and family stories, but also healthcare provider stories into the work that we do so that we can glean wisdom from those stories that then we can apply to our own context and our own experiences. And, I really believe that's why we're here, right? Is to get some of this wisdom then we can use in our own work. So yeah, anyways, that's the overarching why. But why are we here today in particular? The title of the talk Chris came up with, and I loved it, searching for meaning. And I think, you know, that big M, the meaning, is really a big part of what today's all about. First of all, I think over the past few years, it's been really challenging time for a lot of people working in healthcare, and and remembering why we do what we do and searching for the meaning in the work that we do is actually really important, maybe more so now than ever. And so that's part of why we decided to title it "Searching for Meaning." The second one is meaning is really interesting when it comes to meaning and storytelling. And there's a philosopher, his name Paul Ricoeur, who wrote a big book called Time and Narrative, and I do not recommend reading it. But the main thing that he's talking about in that book is how, things just happen to us in our lives. There's all these sort of random or coincidental experiences that just occur. And it's actually through stories that we give those events meaning. We actually connect them together in a causal association using stories. So as we tell stories, we craft meaning around the experiences that we have in our lives. And so that's a big part of what digital storytelling is all about, is finding meaning in these moments that we have throughout the day, and in the work that we do, but also in our healthcare experiences. And then finally, searching for meaning on the platform, the Patient Stories platform. It's a searchable platform, and that was one of the big challenges that we experienced early on. So people would say, "I want to share a story about this. How do I find it?" And Chris had a wonderful idea of creating the platform, making it searchable by keyword and all that stuff. And we're going to talk a lot more about that today. So, meaning, searching for meaning, and hopefully today will be a chance for us to talk about some of these things on a higher level, but also a more personal level with Erin, as we watch her story and talk about it afterwards. So I think that's enough of me talking. Let's watch a story. And so for those of you who've met, you sort of understand the process, but for those who are brand new to this, we will be sharing a platform with you in just a minute. There's almost 100 digital stories, these short digital stories on the platform. And some of those stories were made with me working with people one-on-one, and some of them were made in group workshops. But no matter the logistical process of it, the hallmark of the digital storytelling process is that the storyteller is in control from start to finish. They write the voiceover, they select the images, they choose how to put it together, and then they sort of consult on the discussion questions that are added to the story at the end to help stimulate conversation. And really, the one commonality across all the patients and families who've created stories over the last 5 years is that they're sharing their story to try and help the healthcare system in some way. They're sharing openly and honestly with the hope that we can all draw pieces of wisdom from that story that then we can use in our own experiences. So that's sort of how they're made. And we're not going to go into detail about how the digital stories are made. If you're interested, you can always connect with me, and I'm happy to tell you more about it. But the story that we're going to start with today is by a woman named Annette. And this, I made this story with Annette in 2018 in collaboration with the Seniors Health SCN. And this story's had a big impact on a lot of people who've seen it over the past 5 years. And so we're going to watch it today together as a group. And as you watch, think about one thing that resonates with you in the story. And then afterwards, we'll have just a few minutes to discuss those things in our small groups. We're going to do a small breakout room with three or four people, and you can all chat about the one thing that resonates with you. So yeah, think about that as you watch the story, and then we'll chat about it afterwards. Here we go. Annette's story.
I was 24 when I first moved to Canada. I was in love with the mountains, and Canada had mountains and spoke English, so it fit the bill. I didn't plan to stay, but one early morning on the shore of Lake Louise, on a hike with an outdoor club, I met Hank. 3 years later, we were married in Banff, and we went on a backpacking trip for our honeymoon. For years, Hank loved to climb big mountains in the Rockies, and we had lots of adventures in the backcountry. But as our family grew, our focus changed, and those adventures became more tame. Shortly after our 25th anniversary, Hank started to have difficulty with directions, and I noticed him repeating the same questions to me multiple times in a single day. It took a while to get a diagnosis: cognitive decline, Alzheimer's type. And again, our adventures had to move to easier terrain. For the next 10 years, we continued to walk in the mountains and the local parks almost every day, but eventually I could no longer care for Hank on my own, and he moved into a dementia care facility. As his behaviors became more unmanageable, he was transferred to the hospital. One morning I got a call. The room was dark as I walked in 15 minutes later, with the uniformed guards present. And when I saw his hands and feet restrained to the bed, with him banging the straps against the side of the rails, I felt nausea. I walked right over and took his hand and began talking to him. And within a couple of minutes, he relaxed. When the nurse returned, we undid his restraints while I sat with him. I learned that he had injured 3 staff members, and when I went to apologize, they reassured me that it was not Hank, it was the disease, and I didn't have to feel so dreadful. Events like these continued for several weeks, until eventually the ongoing medication changes softened his behaviors, and the old Hank shone through again. For a while. But even when Hank was doing well, the arm and leg restraints hung on his bed, and the chest restraints sat on the floor in the corner as a visual reminder of those terrible times. I had a visceral response every time I saw them. Eventually, Hank was transferred yet again, this time to a specialized program for complex dementia care. I had to retell our story to this new team of healthcare providers. But they were all trained in dementia care, and although I was tired of telling the story, for the first time it felt like they got it. Hank now has a band on his arm that allows him to move freely. We continue to walk. Now, just walking to the atrium and sitting amongst the trees is an adventure. It has been hard to let go of what we have lost, but throughout our journey we have tried to focus on the joys we can still share together, and our love of outdoor spaces has been front and center.
There we go. And that story. Well, I hadn't watched that in a while. What a story, man. One thing that resonated with me as I was just watching it again right now is just how many layers there are to a story, right? On the surface, it's about dementia care, but it's also about the impact of a family member seeing their loved one restrained. It's also about patient and family-centered care. And it's also about some of these deeper themes of personhood, dignity. And I think, it's been a long time, like I said, since I worked with Annette on her story and watched it. And I guess maybe what I'm reflecting on right now is how there can be so much in a story, so many layers that you can interact with. And you see something different in a story every time you watch it. So, anyways, let's give you guys a chance just to chat about one thing that resonated with you in the story. And we're going to go into our breakout rooms in just a minute here. And just quickly introduce yourself, where you work in AHS, and then just share the one thing that stood out to you. And just so you know, those small little breakout rooms are not recorded. So feel free to share with whatever you want with people. And then when we come back, maybe we'll have a chance to ask a few people to say, to respond to the story in a larger group. So here we go. I'm going to create the breakout rooms. Go ahead and click join, and we'll see you back here in a few minutes. Great. Well, thanks you guys for being part of that conversation. We had a great conversation in our group. It's really one of the great things about something like this is people from all over the healthcare system are here right now. How often do we talk to each other from all of the different silos across all the different 100,000 people of Alberta Health Services, right? So it is a really rich discussion. I hope you guys had a good discussion too. We talked about a lot of different elements of person family-centered care, the experience of someone walking into the room and seeing their loved one restrained, the great sort of conversation that happened between the healthcare providers and the net when there was no judgment, for what happened on either side, right? And it showed a good sort of collaborative approach to care. You know, so many different things. You know, also the reminder of the restraints hanging there and in the corner. And just so you guys know, this story was made as part of a quality improvement project called Restraints as a Last Resort. And we specifically talked about how when they're hanging there off the bed, that normalizes restraints and they're not a last resort, you know, when they're sort of always present in the room. And there's a very logistical reason for that to happen. But at the same time, you know, thinking about it from a patient's perspective, a person-centered care perspective, it takes a different lens to that logistical decision made to keep them in the room like that. So anyways, it was a wonderful discussion. Hopefully you guys had some good conversations as well. I wanted to open it up really quickly to say, is there anyone who would be willing to share the one thing that resonated with them in the story, or be willing to share a bit more about their conversation with their group? So feel free to unmute yourself and just share the one thing that stood out to you. I'd love to hear what other groups talked about or the other things that resonated with them. And it's hard for me to see everyone, so just go ahead and unmute and start talking. You don't have to raise your hand or anything like that if you don't want. And if not, I will ask someone.
Well,
Deanna.
It's Donna Oswald. One thing that struck me during that Annette story was the, you know, how she was apologizing to the staff for having her husband hurt, you know, 3 members, and how they kind of unburdened her and said that, you know, that wasn't him doing that. That was his disease, which I thought was just a wonderful way to help her through that. Yeah, it was a real gift that they gave to her.
Yeah, it was a good response, right? And if you think about person-centered care, that's the right type of response, right? From a person-centered perspective to a non-judgmental response that actually helped her feel more connected to her healthcare team, right? And more on the same page with them. Yeah, wonderful comment, Donna. Yeah. Anyone else? Maybe we'll ask one more.
So one of the things that we talked about that have resonated with all 3 of us in the group was around the use of the restraints that were left in the room, and the fact that it triggered, was a trigger for her. And we kind of said, from like a nursing background from my own career, we would keep, you know, the hand restraints tied to the bed, or the bed restraint there, and so we know why it's there from a nursing perspective. But I think sometimes we forget that it can be triggers to families and patients. So yeah, it kind of all resonated with all 3 of us. Kind of like a kind of keen reminder that maybe those type of things can be taken off in periods that the patient may have calmed and so on.
Yeah, cool. Thanks so much, Courtney. All right, sorry, and I think it was Courtney. I couldn't find you on my screen, but thank you for sharing that. Yeah, you know, it was again a conversation we had as well in our group, and appreciate you bringing that up. I mean, one of the other things that when we shared Annette's story and we were having conversations about it, when you know who Hank was, right? That he was freedom of the hills kind of guy, right? He loved moving, he loved climbing, he loved being outdoors. That adds a whole new level to what it meant to see him restrained for Annette, right? And you saw the flashing images in her mind, right? She sees him restrained and all she can think is, this man's not meant to be restrained in this way, right? He's a mountain climber, he's out there. And so, it adds weight to the use of things like that when you understand that person, where they're coming from. And so, yeah, thanks, Courtney, for sharing that. I think, it's easy to get lost, I guess, in the day-to-day sort of logistics of healthcare. And I think you guys sort of just illustrated one of the best things about a digital story is it starts good conversation, and it helps us be reflective about our work. And, digital stories really aren't meant to tell us what to think, but to give us questions to think about. And how often can we go through every day completely unthinking, not looking at the deeper questions or the meaning of the things that we do? And I think, if AHS wants to be a a learning and constantly improving organization, every once in a while, we do need to stop and think about what we're doing, right? Reflexivity is a central tenet of professional practice, and digital stories can help us do that. So thank you all for being part of that conversation. You guys sort of just illustrated what we're sort of hoping for from these stories, is to start good conversations, to give us questions to think about, to be reflexive about the things that we do. And you know, every story has lots of layers to them. And so whether you work in long-term care or not, I'm sure there's things that you could connect with, wisdom you could draw from a story like Annette's, or from any of the other almost 100 stories on the playlist. So with that, I'm going to throw it over to Chris. He's going to tell us a little bit more about the playlist, and then I will get to watch a story, Erin's story, and we'll chat with her about what it was like to make it afterwards.
Great, thanks, Mike. And I was just having a look at the chat and some really good comments in there. So if you have a chance to breeze through those as you're listening, and we can talk a little bit more perhaps in the discussion. But we want to talk a little bit about the history of digital storytelling in AHS, and with about the last decade or so, you know, certainly early in the formation of AHS, engagement and patient experience, along with a lot of other departments, have been working really hard to elevate the voice of patient and families across the organization. And it was really that time that it was recognized that, you know, the power of storytelling as a way to influence change and improvement, and the patient and family advisors who we were interacting with had some really powerful experiences, sometimes positive and sometimes negative, with the healthcare system, that we really wanted to share in our effort to be a learning organization, like Mike had said. EPE originally started capturing some patient narratives in a written format through interviews with advisors, and with the goal of trying to capture those stories. And while obviously the stories were compelling, it wasn't quite the same as being able to really hear the voice of the patient and to see the images and to see the pictures that would sort of accompany the story. So, you know, with a large provincial geography and a limited pool of advisors, you know, generally, we had to think creatively about ways of sharing stories. It was that point that the digital story method was introduced to us as a way of sharing those experiences and using the multimedia format, like you saw, with the combination of images, of music, of transitions, that really it was a way to create compelling stories that could be easily shared and easily accessed across the province. So, you know, what began as a single workshop, I believe was offered in Calgary, the first one, through our work, really grew and became workshops that were delivered across the province, as Mike mentioned, working with individuals as well in different locations, and certainly different programs and services within AHS also working with Mike to develop digital stories. I also want to acknowledge and express our gratitude to the leadership and active support of Dr. Yu, who recorded a video in support of the power of digital stories, who is really a strong proponent in their use, and really lived that by using the stories in her practice, always, you know, asking for stories that would be appropriate for different audiences that she could incorporate into presentations, both within AHS and outside of AHS. And just really wanted to acknowledge our appreciation and gratitude for that leadership that really helped pave the path forward. We'll go to the next slide, Mike. So, you know, with the growing number of stories being developed, you know, through EPE, and as I'd mentioned, through other departments as well, it was really starting to become a challenge. What started as a few, you know, manageable stories in terms of, you know, knowing what was on the list, the list began to grow, and with that too came our ability to sort of know, especially for our providers and teams, like what stories were out there and which ones could they use. We'd actually heard back from some of our users that they really wanted to use the stories, but they just didn't have the capacity necessarily to filter through all of them. And, you know, we have them hosted on a YouTube list, and that still is the home for them, but that list wasn't searchable, and it was, you know, it became an increasing challenge. So, really what we wanted to do is to find a way to get our list searchable and to make sure that people could find the stories that had meaning to their area of practice, and on topics that they wanted to share with their teams and with other providers. So with that's came the vision for the Digital Stories platform. And, we had the idea, as Mike had mentioned, we spent some time trying to explore, and it didn't happen right away in terms of the vision and knowing where we could go. And we didn't have a big budget or anything like that to just sort of go out and fulfill it. But we found an amazing partner in our digital services team with the communications department. And it was really through the commitment of them. And I'm going to shout out to Marnie Bartle in particular, who was really an amazing partner in bringing this to life and using some of the existing platforms that they had in code, but to really spend some time to bring the playlist onto our AHS site. So I suspect some of you are familiar with it, but for those that are not, we want to give a chance to sort of do a little bit of a walkthrough. The vanity URL is one we tried to keep memorable, and so it's www.ahs/ or .ahs.ca/patient stories. It'd be memorable if I said it properly. And then we're gonna show you, give you a little preview here of what in fact it looks like. So with that, I'm gonna share my screen. All right, so here we go. And so here's the platform. It's hosted on the ahs.ca website, as I mentioned. So it is external facing, and that's something that, from the beginning that we had worked with our advisors to ensure that the stories were accessible, that they would be hosted on an external site. So those stories still live on the YouTube platform. That's still there. If you may have it bookmarked and you may go there to look for stories, but we've created this parallel searchable platform that really helps to highlight those stories. So you can see here on the page, it's just a basic introduction, and it has a search function. It's got the ability to decide how many stories you want to view. If you just want to view a list of 10 per page, up to 100 per page. And really what you can do is go in and search based on the title, a keyword, something that is of interest to you. So if we were thinking about Annette's story, for example, we can certainly look at, say we want to look by the topic of dementia. So if we type that in and spell it correctly, we can find, there's my problem. We can find that there's a number of stories actually that come up when we do that search. There's actually 9 entries out of the 96 stories. And we can, as we scroll through, we can see a number of them. And in fact, it's not till the second page that we got to Annette's story. So broad topic, obviously a number of stories have been done on that topic. But we may want to, look through things a little bit more specifically. So we can also, simply choose another word. If we happen to remember that it's Annette's story, but we just don't know where to find it, we can type the starting of Annette's story. And now it's only one entry that comes up. So ultimately, she's the only one that mentions the name Annette. So we have some duplicate names. So sometimes if you put a name in, you can do it as well. But then, of course, there might be particular topics that we'd interested in. And of course, a key one with this story is around restraints. So again, we can find stories that mention restraints either in the description of the story or in, there's also keywords that lie behind these entries as well. So it's a way of us trying to get a robust collection of words that help people ultimately navigate and find the story that they're looking for. So in this case, we happen to see that there's 4 stories that mention Annette, or mention restraints rather, and Annette's is one of those 4. So you can see through that process, really certainly accessible. Really want to encourage people to ultimately to access this new platform. Really excited. It's been a few years in the development, and to be honest with you, we've been sitting on it for a little while as we've gone through COVID. It's been out there and posted, as some may be aware, but we were looking for the right time to really bring it forward and encourage people to start using it. So please share it with others, please promote it, and would encourage you to take a look at it yourself as a way to really easily find the stories. And so I think with that, Mike, we're going to go back to you.
Yeah, great. Thanks, Chris. Yeah, man, what a passion project. I'm sure you can all appreciate how much work went into getting a front-facing web page on the AHS website. So huge kudos to Chris and the comms team for getting that done. So I want to talk really quickly about how and why. You might want to share some digital stories just to give you guys some ideas. Obviously, hopefully you have some of your own ideas about where to share the stories and how to do it. But really quickly, we're thinking, presentations like this, different meetings, monthly meetings, weekly meetings, communications, email, newsletters, things like that. There's lots of different ways to share the stories. Really what we're hoping for is to be able to embed the patient experience into routine clinical practice, right? So your monthly meeting, you watch a story, you talk about it for 3 minutes. It takes 7 minutes of your meeting, but you're starting with the patient's voice. And I think, that could totally change the tone for the rest of the conversation that day in that meeting. If you could do something like that. And for a while, we did have a number of units at different hospitals in Calgary who were doing it. They were starting their meetings with stories and using those in different quality improvement things. So anyways, presentations, meetings, communications, there's lots of different ways to share the story. One thing that we really encourage is to make sure there's room for some sort of conversation around it. Either reply to me in an email with one thing that stood out to you or something like that, because the best part about them is the conversations they start. So, different other ideas, advocacy. There's certain ways that, and if there's a specific topic or idea or theme that's really matters to you, that you're hoping to advocate on behalf of within the healthcare system, that's digital stories a great way, obviously, to help people understand why it matters, and not really tell them what to do, but sort of engage them, sort of bring them into that conversation. Education, like I mentioned, Restraints as a Last Resort was a quality improvement initiative by the Seniors Health SCN, and they use that Annette story as part of their educational sort of package that they sent out to the different partners they were working with, and also included in all the presentations, not all, but a lot of the presentations they did about restraints as a last resort, as a way to engage people and to get the conversation started. Quality improvement, again, Net Story is a good example of that. Another example is, in the Calgary zone, they did one about NOD. And name tags, right? Name, occupation, duty, and name tags. That was a quality improvement initiative that they were trying to get some momentum behind. So they made a couple digital stories about those things that then they used in different quality improvement sort of initiatives around the Calgary zone. And then finally, I would say pretty much every story has an element of person and family centered care, because like we talked about earlier, asking what matters to you is the beginning of person centered care. And so digital stories, they innately talk about what matters to patients and their families through the stories, that the moments they choose to share with us help us understand at a deeper level, what's going through people's minds as they interact with the healthcare system. And so there's lots of different ways to do them. That's just a few sort of high level ideas for you guys. Chris and I have actually put together a short 2-page how to share a digital story screening and discussion guide that Chris will either throw in the chat right now. We're still doing some final edits to it, so you can download that. And we just sort of walk through the whole process of choosing a story, of setting up the conversation, with a bit of preamble, how to watch the story, some of the technical stuff of that, and then how to talk about it afterwards. Because really sometimes it is a little daunting, right? You show a story, and as you saw today, you ask people what resonated with you, and it's silent for a few minutes, and you're sort of like, what's going to happen? And so it is a little scary sometimes to put a story out there. But when you think about it, patients and families, if we're a little nervous to share stories and try and talk about stories, imagine them, right? They are sharing pieces of their lives with us. These are not just little products. These are people's lives, and to honor the vulnerability and honesty that they had to share the story in that way, I think we need to do our best to try and engage with those stories in a meaningful way. So yeah, there's some of the how, so hopefully some ideas, and of course, like Chris mentioned, feel free to connect with the patient experience team. We got the email at the end. They're happy to chat more about different ways that you could incorporate it, and so put out an idea, and happy to connect with you about some ways you could do it. So here we are. We're going to watch another story, and we're going to talk with Aaron about it. Aaron was part of a workshop up in was it Grand Prairie? It was a while. I guess it was pre-pandemic. Everything seems like a long time ago if it was a pre-pandemic, but it was an in-person workshop. There was 6 of us in the room. It was really wonderful story. So we're going to watch Aaron's story. And again, just think about one thing that resonates with you. And we won't have a chance to chat about it, but we'll have a chance to chat with Erin about her story afterwards. So here we go. Erin's story.
It was Christmas Eve as we took our 6-month-old baby boy on his first drive of many to the city. We had high hopes of seeing the neurologist and getting positive answers for Nate's delays. I had been holding on to the words spoken by other healthcare professionals, like holding on to the edge of a cliff for dear life. He will grow into it. He is doing so well. He is thriving. But I analyzed the other boys his age, walking, eating food, talking, and playing. I knew these words can't be true for him. It was on that day that I lost hope, with 2 words: massive stroke. Seeing his brain damage was overwhelming. The only words I can remember from the healthcare professionals that day were profound deficits, may be in a wheelchair, drooling, may never speak, may not understand you. I remember sitting in the shower of our hotel room, curled up in a ball. Tears were rolling down the drain, with the water cleansing me. I sat there for a long time to find the strength to stand back up. I wasn't ready to hear the possibilities to come. That drive home, I felt like an empty shell of who I used to be. Our next 2 years were a roller coaster. Appointment, diagnosis, therapy. Appointment, diagnosis, therapy. Appointment, diagnosis, medications, therapy, surgery. Appointment, diagnosis, medications, therapy, surgery. These 2 years were a blur. This journey consumed our family, my spirit, and my world. I wrestled with the thoughts of what needed to go into each day. I would tell myself to breathe, but I couldn't catch my breath. It was hard to admit my reality to myself. I felt inadequate. How can someone with no education in the medical field accomplish all this work? Am I the best person to help Nate reach for the skies? I started researching, and we moved to Edmonton for 4 months, where they gave me a crash course in therapy and the importance of early intervention. They made me feel that I could do it. With the help of our new rehab team back home, I gained new strength. They continued to model and teach me the best ways to give Nate a fighting chance to improve and to beat the odds. I started hearing the words, improvement, possibility. The sky is the limit. My faith started to turn into hope. After 2 long years, Nate stood by himself for the first time. At that moment, in our living room during Christmas, it felt like the sky opened up and the light shined down on my little boy. He was a fighter. He was defying the odds. Nate can now talk full sentences to express himself. He can run with his sister. He is starting to use his right hand. He is playing with his friends and going to school. He seems fulfilled. I am now not comparing my little boy's journey with other kids. I found my acceptance, that he is on his own path, and that's okay with me. Thanks to the support of our doctors, rehab team, family, and friends, Nate is reaching for the stars. He is the superhero of his dreams because of the continued support from our medical superheroes.
There you go. Aaron's story. Man, what a story. You know, I'm a dad now, so I get a lot more emotional when I watch stories like that, Aaron. It's an amazing story. So yeah, I'm sure there's things that resonate with you guys, but we want to talk with Erin about her story. Because I think it's important to know who are the people who've chosen to create a digital story and share it with us. Such a personal story. So Erin, go ahead and unmute yourself there. And maybe let's start with that question. Why did you decide to share your story in this way? Why did it matter to you to make your short story?
I felt that it was a powerful way at that time. It was a bit of therapy at that time in my journey, I guess, with Nate at the same time, that which resonated in that last video, that she had repeated her story so many times, that I think that's why I personally wanted to really do it too, was that it was a piece of me putting it out there of this is what we're going through, and for people to recognize that. And I guess, yeah, like my biggest reason too, when I was asked, was, to help AHS understand that parent's perspective. And I guess my biggest thing was the use of language was so important in my story. And the only small things, they probably said a lot more to me at that time, but I only held on to certain words that were spoken. So I guess that parent readiness and recognizing words are so powerful to parents at that time.
Yeah, and that's a big part of your story, right? And when you say all I remember, and you list off the words, right, that you remember, and I think that's really important. When you're receiving a life-changing diagnosis, to recognize, and I think a lot of healthcare providers do recognize some of it sinks in, some of it doesn't, and so you may need to go over these things again, and choosing your language really carefully during these sort of life-changing moments matters, right? It's an important thing to do. Yeah, I love that part of your story. And then the words start to change a little bit at the end, right? After all that support. Yeah, I love that. And so, what was it like for you to make it? You mentioned a little bit, it was a bit of a therapeutic experience to go through that at that point with Nate. But what was it like? What was the workshop experience like for you?
It was a very welcoming experience, actually, and overwhelming. I don't know. I felt very empowered when I was there, but it was also just overwhelming analyzing my own journey from start to where I was at that point in time. So I guess it was a lot of emotion, but even as someone who was asked to do this, it's helped me have even this platform of talking to different people who have never known about Nate. I just said, hey, why don't you watch my story to tell you the truth, so I don't have to start from the beginning to now of and I always want to end with that positivity that, Nate was here, but now we're here. We're we're looking towards the future and all the positive sides of things.
Yeah, it's interesting. I think we talked about it in the workshop, but we don't really stop often to think about our lives as a story. And so when that happens, there's of course lots of emotion, but there's also a recognition of where you were and where you are. And I think that's really sort of a cool way to sort of think about, a digital story, right? Is there's always some movement there because it's a story. There has to be some movement. And because of that, there's things that we can learn from the story. Yeah, I love it. So, so you mentioned, it got a little easier to share about your experience. And so what has it been like for you? I mean, your story has a lot of views. So what has it been like for you to put yourself out there in this way, and sort of what happened after you created the story and started sharing it with some people?
Yeah, it kind of took on a life of its own for me, I guess, and was shared a lot. And a lot of people kind of reached out who I hadn't spoken to in a long time and things like that. I don't know. It made me really humble, I guess, at one point, to just see how many people, care, and also just a lot of people reached out and were telling me just how they connected, and then were asking me questions about how, like, what they could do for their own child and things like that. So it just, I don't know, which I guess it helped me kind of move toward that advocate piece. And even in my career and everything, I'm just even more passionate about it ever since, you know what I mean, about advocating for those kids and stuff like that, and helping those parents kind of navigate the system, because AHS can be overwhelming when you're beginning to work with the system. And especially if you're in the north. We're here in Grand Prairie, and a lot of parents with complex kiddos need to go down to the city. So a lot of them kind of come to me here.
Yeah, you become that person. Yeah, and I mean, what I really like about your story is you really walk through the whole process, right? So people, they get just a general idea of where things could go, right? The types of specialists they may be interacting with, the feeling of being overwhelmed, just to know that that's normal, and then all the different supports and services you sort of list off, the therapies. You don't say specifically what it is, but people start to recognize, okay, there's lots of things here that we can access. And I think that awareness is just so important from a community member perspective. Just knowing that there is things out there to look for is an important starting point. So that's awesome that you sort of became that person. One final question here before we wrap up. I guess what do you hope, you sort of answered this a little bit already, but what do you hope healthcare providers or people that work in AHS do with your story now that you've made it?
Well, one thing, I guess, like, my son had a perinatal stroke. So that was one thing that's not as common. I didn't even know that children could have strokes. So that was one piece that I did not know or have any connection of anybody else that had been through this. So I'm hoping that having this story will allow you guys to share it with those parents if they've gone through the same thing, because early on it feels pretty grim. So to see that, oh, well, there could be light at the end of this tunnel, and we don't know what the circumstances will be. That's one. I guess, and the other thing, just to bring light for more of the AHS employees, would be that, again, that use of language was so impactful for me. And like, I still remember now, and I use that word massive stroke because that's what that neurologist said to me at that day. She mentioned perinatal stroke too, but the only word that resonated me was when she showed me the image of his MRI was he had a massive stroke. Look at the darkness. And it was like, so that was the word that resonated with me. I didn't hear anything probably after that, right?
Yeah.
So I guess it was just that use of language and what the parents' readiness is at that point, right?
It's really initial important. Sort of conversation.
Yeah,
there's lots you can learn about those initial conversations from a story like that. Awesome. Well, thank you so much, Erin, for being willing to share your story, and then also being willing to come and talk about it with us today. Like you've already said, it's had a big impact on many people already, and hopefully continue to do that through the platform as more people find it and start sharing it with others. So thank you for being here.
Thanks for having me, guys.
We usually do something like this for the storytellers when we do the workshop, but thank you, Erin. Yeah. Awesome. Cool. I'm going to throw it over to Chris really quickly to talk about some next steps here.
Great, thanks so much. Thanks again, Erin, for coming on today and sharing. And thanks, I've seen in the audience too, we've got a number of storytellers that are in the audience, so we see you out there, and just want to say thanks to each of you as well for your participation. And we may be knocking on your door soon, because we're going to talk a little bit more about some of the opportunities coming up. Certainly, as we mentioned, we want to really elevate and promote the search platform, so please share it with others, let people know, and we'll we'd like to see our numbers skyrocket and those stories getting used more and more. We're also going to begin starting to host quarterly screenings. And so certainly as a registrant of this session, we'll send you out a reminder email when we firm up those dates, but we're going to do screenings, not with so much of the content that like we've talked today, but just the discussions like we had with Aaron about, and giving people the opportunity to reflect about what those stories mean to them in their practice, and talking with our storytellers as well. A takeaway and an action item that we'd encourage you to do, as we've shared, is to start using these stories in your practice, to really think about where are the opportunities that you could bring a story to a meeting. Get on the platform, think about the topic that you're looking for. And if you have any questions, absolutely happy to respond to any inquiries that you have. You can email us at thepatientengagement@ahs.ca. And we'd be happy to support you in any way possible. I've shared the couple of links to the resources, both the screening guide and the overall practice guide, which is the longer document that gets a little deeper into some of the pieces around digital storytelling. So if you have questions about those, and we'll send out a link to those as well in a follow-up email. But with that, we're at 12:58. I know Mike is on a tight schedule, and I know everybody else is as well. So off to hand it back to you, Mike.
Yeah, just final comment. I think, Aaron also highlighted another great use of these stories to share with other patients and families, right? And so that might be something that another way we can incorporate the stories into routine clinical practice. Here's a story of another family who experienced a perinatal stroke. Watch it, and then you can come back and ask any questions you want, and that might be a great way of helping people know where to go with the stories. Anyways, final thing here, another favorite quote of mine: each of us is an artist of our days. The greater our integrity and awareness, the more original and creative our time will become. In the process of creating a story, people become an artist of their days, right? And I think it's a really great final thought to think about, because I know all of us here, healthcare providers, but also maybe have had healthcare experiences. And, we don't get to choose what happens to us, but we can always choose how to tell the story. And that gives us all a sense of agency about the things that occur to us in our lives. And Erin didn't get to choose this, but she did choose how to tell the story. And in that way, she's taking back a little bit of control about what happened to her and her family. And so thank you all for being a part of this conversation. We hope to see some of you all at the conversations that we have, the quarterly screenings. Thank you for being here, and have a great rest of your day.
Thank you.
Great.